is my privilege and pleasure to introduce our first speaker, Nick Desmarais. Nick is the chairman and co-CEO of AppDirect. Nick, over to you.
Thank you, Renee. I appreciate the introduction. Thank you so much. Let's move to the next slide, please. So, anyone that knows me knows that I like to stay very focused on our mission and vision. So for AppDirect. And so I try to keep things very relevant to what what we excel at and what we're focused on. And so this is a bit unusual for me because it strays from commerce, obviously. But COVID is very relevant and it touches all of us, our businesses. And really on two vectors. One is health, the health and wellness of our team members, but also our partners. And the second is on the economy and the economic impact it's having, right? So, AppDirect's grown, we've enjoyed a lot of growth and we've been fortunate over the last, couple of years. And, as a commerce player, we do over $1 billion and well over $1 billion in sell through the marketplaces that we power. So we are affected by economic trends. So we spend a bit of time looking at macro trends and I'd like to take a bit of time just talk through some of these today. And it's important to note that, while, we have our usual AppDirect vision mission, we do have a particular mission now during this COVID period of doing everything we can to ensure the health and wellness of our employees, our global team members, as well as our partners, and doing everything we can for them and their families. And this is a big part of what underlies this presentation. So I'm going to spend about 10-15 minutes going through some of the latest COVID-19 trends that we're seeing at AppDirect and our interpretations of them, as well as high-level economic impact. And then some of my colleagues will go deeper into those impacts. So the first graph here shows a Johns Hopkins dashboard that is publicly available, so everyone can access this dashboard. And it shows a glimpse of where the COVID-19 pandemic is at. The couple of things to note here is effectively that it is affecting most, if not every country in the world at this point. And we've passed 1 million infected individuals. So I won't spend too much time going through this dashboard, but it gives you a sense of where we're at now from, baseline of almost 0 in January in the spread. This dashboard is accessible to everyone and it's free. So you can also help yourself to this dashboard if you haven't seen it already. Let's move to the next slide. So when we're thinking about a contagion or a pandemic, there's a couple numbers that are important to understand to really understand the trend lines and where things are going, right? And a lot of institutions are sometimes hesitant to forecast where they see the projections. So as an institution, sometimes it's helpful as a business to look at it yourself and get a sense of where you think things are going. I've always, kind of felt and thought that humans tend to be linear thinkers, at least I am. And sometimes, seeing things and understanding exponential growth can be challenging. So I personally like to model things out and get a sense of where things are going to better anticipate where the market is going, as well as these general trends. The R0, the top right box, box 2, is one of the most important numbers to understand. And effectively, what you're seeing here are the metrics that are most important to really understand the replication, understand how the virus function relative to other viruses. So what you're looking at is SARS, MERS, COVID, H1N1, and just a seasonal flu. And for each one, you have each of the most important metrics, one of which I think number 2 is the most important. It's the R0, which is a replication number, which effectively means that COVID has an R0 of about 2.2, and it ranges from 2 to 3, depending on the source. But what it means effectively is if one person gets sick, then 2 more will get sick. So 1 means 3. 3 then means that 6 more means 9. What that effectively means that when you extrapolate the R0, is when we did our initial forecast a couple of weeks ago, we had us at passing 1 million by Sunday, and we passed 1 million on Friday. So the R0 is pretty accurate. The R0 has us at about 10 million in 2 weeks from now, 100 million in 4 weeks, and 1 billion in 6 weeks. Now, of course, that's not a given, right? An R0 can fluctuate depending on policy, but still the status quo is an R0 of 2.2 right now, unless more action is taken to bring down their R0, which is why you hear a lot of politicians and leaders talking about 30 to 60% of the world getting infected, because that is a logical path of this R naught. The second number is the fatality rate. Now, there are ranges here, but they tend to be now between 2 and 5%. The World Health Organization right now, I believe, has it about 3.4%. If you take the current WHO snapshot of infected cases to fatality, as well as the Johns Hopkins numbers, those numbers look at it, they really stand about 5% fatality rate currently, which is high. And you can see how that compares to H1N1 and the seasonal flu at 0.06. So there's obviously a huge gap between COVID and the seasonal flu, but it's not as high as MERS. But that's not necessarily a good thing, in the sense is the logic of contagion is that the mortality rate is too high, then it obviously hampers the R naught. So that you got to look at a balance of the R naught and the fatality rate, and often a lower fatality rate may have a higher R naught, and that actually leads to a higher fatality absolute number overall, unfortunately, which is what you're seeing here when you see MERS has a R naught under 2 or under 1 versus COVID with a much higher R naught. The other part is the incubation period. There's a incubation period that's actually quite long for COVID relative to other viruses, which means that you can basically have the virus for 6 days before feeling the onset of symptoms. And the current consensus is that you're contagious during those period, during that period of time. The actual contagious period is not known yet, but you can see how that compares to others. It will make these slides available, so you'll be able to look at the data and digest it more. Let's move to the next slide. So this slide is a bit outdated, but it's an interesting way of looking at how it compares, again, another snapshot of how it compares to other viruses. The y-axis is fatality rate, and the x-axis is looking at the replication or the R naught of how contagious it is. Now you can see that what's happening here is these slides are, I believe, from late February. So initially they thought that the fatality rate was somewhere between 0.1 and 2, and they weren't really sure. At this point, this has moved up to between 2 and almost 6%, probably more 3 to 6. So at this point, the fatality rate is actually above the Spanish flu. So imagine this pink box actually being higher between SARS and the Spanish flu. And that's where the current WHO, as well as Johns Hopkins numbers and CDC numbers are landing at, which is more closer to the 5%. So it is quite a bit deadlier than the Spanish flu. And keep in mind, the Spanish flu had serious consequences worldwide. And some estimates are that more people passed away because of the Spanish flu than World War II, to give you a sense of the magnitude of the Spanish flu. Let's move to the next slide. And again, the idea is, and again, I tend to not look at the news. I don't like sensationalism. I'm very obsessed with data and looking at the raw data and getting our extrapolations. So again, the idea here is not to sensationalize, but the idea is that knowledge is power. And you're all business leaders on this call, as owners as agents and owners of your businesses. I think having that information is helpful for you to make the right business decisions, and also make the right investments, and also help your community. So one notion that I want to dispel here is this notion that COVID is really something that only affects elderly people, right? Now, it's true that the fatality rate, case fatality rate, is higher. As you see on the left side, you have fatality rate by age groups. It tends to be higher as you get older, but really the big risk factor is underlying issues and conditions. So on the right, you can see underlying conditions, whether it be chronic respiratory disease, hypertension, diabetes, cardiovascular disease, and you can see that there's a heavy correlation between underlying health issues and mortality. Now, again, when we think of ensuring the health and wellness of app directors and our partners, this is why we're giving these presentations, because knowledge is important. And if there's a single person on the phone that has one of these issues, for example, asthma, this presentation was worth it. And this was worth our time for that single reason. We're not giving this presentation for economic reasons at all. This will not affect our business. This is really because part of our mission is the health and wellness of our partners and our team members, and we take that very seriously. We see it as a moral imperative. So if a single person on the phone sees that they're, more at risk, and because of that, they change their behavior, then this call was worth it 100%. Let's move to the next slide. What's also interesting is that things aren't a given. We actually can really affect outcomes. And you can see here by age group, we show the fatality rate by country. And you can see that there's a big delta between Italy and, let's say, South Korea, right? 20% mortality versus 13% for people in that higher age bracket, right? So the idea is that there are things you can do that are worthwhile, and it's worth studying what is done in Korea around testing, tracking, but also following up with people when they're not well. If you get infected by COVID, often you're sent home. What's important is what we've encouraged all our AppDirect team members and all of you is to have a buddy system. If you live alone, to make sure somebody calls you every 6 hours to keep track of how you're doing. And by hearing how you kind of articulate and how you speak, they'll get a sense of your baseline and if you're going down. And deterioration can happen very quickly. In under 6 to 12 hours, you can go from a blood saturation of oxygen above 95 to sometimes as low as we've seen in some homes below 80, right? And that's very dangerous. And the sooner you get medical care, the more likely you're not to suffer respiratory failure. And it's much harder to treat somebody that has, an acute respiratory distress syndrome than somebody who does not. So what we've seen in our communities, we've had, unfortunately, some people infected by COVID in our community, in our teams, and their families worldwide. And what we do is we have oxygen meters available at different locations. So we get an oxygen meter in their hands so that our team members and their loved ones can measure their oxygen. So I would recommend an oxygen meter is not one of these things where they're running out of because one can be shared. So that's one thing that you can think of doing is get an oxygen meter for your team, and you have one, you can send it to employees. Of course, if it's being used, make sure it's obviously extremely clean and they clean it before they ship it, and be very cautious around sharing any devices between people that have been infected. Let's move to the next slide. So the other important point here is it's not just about mortality, it's also about hospitalization. So 1 in 5 people that will get infected by COVID will also be hospitalized. And 5% of the total of the 100%, 5 out of 100 will need intensive care, will be in the ICU. Okay. So again, a lot of people say, well, look, the mortality rate's only a couple percent. I'm healthy, I'm fine. Well, look, being hospitalized isn't fun either, right? And 1 in 5 people are getting hospitalized. And that's an important point that then speaks to the next slide, which is the policy. So the issue is that when you look at the R0, you look at the hospitalization rates, and you look at the amount of testing. This slide shows you the amount of tests being done per million. And you can see the United States, as of recent, is really not testing a lot compared to, say, South Korea that has had better outcomes. So when you're looking at the R0 and the lack of testing, let's move to the next slide. And then the problem is a lot of people get infected before they show symptoms. So the issue is when you look at the current number in the States, we haven't tested a lot, so the number is quite a bit bigger of actual cases. But when you look at the 2 curves here, the yellow curve is the known cases. The green curve is when people actually got sick. So what's happening is that the amount of people infected is actually quite a bit higher than what we think. And if we move to the next slide, what we see is the current Imperial College, some of the forecasts of where they think the actual rates are at right now. So Italy, for example, only 100,000 people got infected, but they currently think that maybe up to 10% of the entire population of Italy is infected, but aren't really symptomatic yet. And that's starting to spread, or they've had lighter cases. So that goes to show that if you move to the next slide, why there's such a drastic government reaction. When you look at the R0, the spread of it, the fact that many more people probably have it than what we think, what they're very worried about is bed availability. And a lot of people on this call have heard of this issue around bed availability, but the reason why there's an issue is because the United States, for example, only has about 3 beds per 1,000 people. If half of the American population gets this, which is where it would be going on this R0, then you would need 100 beds. So basically you're 97 beds short. And that's a big issue, not only for people with COVID, but for anybody else who needs access to an ICU. And again, the reason for this is, again, we're spreading awareness around health and wellness. But obviously as a business, we're concerned about the economy. And this is having a big impact if we move to the next slide, because it speaks to the types of policies that we're seeing. And this is why they're having these global shutdowns right now, these lockdowns or shelter in place. Over 1 billion people worldwide right now are in a shelter in place in a lockdown mode. And the reason why this is important is if you move to the next slide, is because the governments are trying to move down the curve, the contagion. And effectively, this is when people refer to flatten the curve. If the orange line is the capacity of the healthcare system, anybody that gets sick above that line, the purple area, will not be treated well, making fatality rates rise. Whereas when it's in the green, if you flatten the curve, the same amount of people might get sick, but we have better care for them. And that explains, when you look at that R0, you look at the bed availability, that explains this policy that there is right now around this notion of flattening the curve. Let's move to the next slide. Now, the reason why they're doing this, by the way, is because it's worked before. The data I'm showing you here is from the Spanish influenza. On the left side, you have Philly versus St. Louis. St. Louis took very draconian, hardcore measures around shutting schools, shutting down all public venues. No matter how much people didn't like it, no matter how much complaining, too bad, that's what they did. Philly did not. They stayed open. And when you look at the mortality curve of Philly versus St. Louis, it's mind-boggling. So that's the difference between, a social distancing policy versus not. And on the right side, you see that that's actually the case across all the cities and states during the previous contagion. So there's evidence to show that the R0 is high, therefore hospitalization rates are high. Combine those two things, you're gonna need a lot of bed availability. We don't have it, so flatten the curve because that's worked in the past, okay? Let's move to the next slide. And it's actually kind of working now in some countries. So when you look at the time day since patient zero in different countries, if you look at Singapore, Japan, South Korea, they're having much better outcomes. What's going on there is they're very aggressive at testing everybody. So that goes back to the testing that we saw earlier. Very good at tracking. If one person gets sick, they track everyone else that was in their vicinity or who's any other person that's had interaction, and making sure that they test to make sure that then we quarantine those who are sick and give more liberties to those who are not. And then they're very good at monitoring. That's something that we're not doing very well necessarily in North America, or where somebody gets sick, they're sent home, but the healthcare system isn't calling every 6 hours to figure out, is this person, how's the condition going, and the oxygen saturation, to make sure they're getting medical help as soon as possible before they get to a critical point. Okay, let's move to the next slide. Now, the issue is here economically, and I won't go too deep into this because Aaron Stern, who's a great investor, is gonna talk about this in a bit. But effectively, when you're looking at these factors in the government response, what you have is empty streets. In other words, economy is about supply and demand, and the demand side has taken one of the biggest shocks we've had almost in our history, in fact, in human history. So let's move to the next slide. And what's happening here is that, of course, it's having a massive impact on the equities markets. The Russell 2000 small businesses have been impacted the most. But what's interesting is that not all businesses are created equal, right? So when you're looking at bonds being issued and the health of those bonds and downgrades on the right, you can see that actually in our space, telecom and technology towards the bottom, right, we haven't had as many downgrades. So we've been fortunate in that the space that we play in, and all of you as agents, has actually fared much better than, let's say, obviously transportation or hoteling, where there's those bonds that have been issued have been downgraded by the S&P pretty dramatically, right? So that's part of the reason why, as a business, we've seen a lot of our agents have actually done quite well in Q1, and AppDirect had its best quarter actually in our history. And part of the reason why that is because we're not seeing telecom demand and cloud demand going down, and particularly cloud is on the rise because of work from home. So some industries have been insulated, and that's not a bad thing. That means that it really helps foster employment where possible. Let's move to the next slide. Now, unfortunately, these are probably some of the most frightening slides. Is on the left, you're looking at unemployment claims, right? So if you look at unemployment claims, even during the last recession, we're talking about like 600,000, right? We've had, millions in the last week alone. And what's striking is, when you look at the St. Louis Federal Reserve, they're forecasting 32% unemployment. Now, I hope that doesn't happen, but the current Federal Reserve St. Louis, their current forecast is 32% unemployment for Q2. To give you an idea, the Great Depression had an unemployment rate of about 20-25%. Okay, so that should give us all pause. So we all need to think about, as business leaders, and you're all on this call business leaders, is really thinking about now what measures are you taking to handle the fact that this is likely to happen in Q2, right? Now, unemployment does not necessarily mean that businesses go insolvent, and businesses have to go insolvent for them to actually cut their communication lines, which would affect all of your businesses. So I think there's quite a lag. I think that our businesses would only be affected by Q3, Q4 because unemployment would be the first hit. The second hit would then be solvencies, and solvencies then would affect obviously people's subscriptions in annuity, book of annuities around telecommunication services. Let's move to the next slide. So there's some silver linings here, and I think I'm going over time, so I'm done here. One is that there's some evidence to suggest that potentially temperature and humidity levels may slow the contagion and help a lot. So on the left, you have the numbers from SARS and showing how the daily incidence rates go down with temperature. And on the right, you show peak influenza with humidity, and that also impacts it. So again, summer's coming, so that is a good thing. Let's move to the next slide, potentially. The other part is there's a lot of therapies in the works. There's therapies and trials worldwide, treatments, and there's over 80 trials worldwide. Hydrochloroquine is one of the more important ones. But if you move to the next slide, we have a quick slide here that shows you the different type of treatments. I think one of the most important ones is hydrochloroquine, which is an immunosuppressive drug for malaria. So it's been used for decades, actually, and it's been deemed safe for malaria. But there's some evidence that has worked well. And the theory behind using them is that chloroquine can change the acidity on the surface of the cell, and that basically prevents a virus from infecting it. So that's the idea behind hydrochloroquine. You have Kaletra, that's a drug that's been used for AIDS historically, protease inhibitor for HIV. And that seems to also have had a good impact. And favipiravir, which has been used in Japan for the flu, is another one that's being tested, and it's by Fujifilm. And, I'll leave you on this last note here because, it's kind of interesting when you think that one of these drugs is being developed by Fujifilm. Now think about that, right? And I think there's a learning there. And that, survival of the fittest is often about, and this is something Deb reminded me of a couple of days ago, it's about adaptability. Now, there's a learning there because Fujifilm, unlike Kodak, didn't go down, right? When things went digital and platforms like Facebook drove companies like Kodak out of business, Fujifilm took a step back and they looked at what are we good at? What is our comparative advantage? In the same way that you can take a step back if the economy takes a downturn, hey, what am I good at? Trusted service assurance, those relationships. How can I leverage that? And what Fujifilm's insight was chemicals. Chemicals are needed for printing film. And they became one of the greatest cosmetic companies in drug manufacturers. And Favi is one of the front runners for this pandemic. So there's a learning there that's all about adaptability. And if there's a takeaway here, A is really looking at the health and wellness of your teams. And there's things we're going to talk about. 2 is looking at the economy and really staying ahead of that curve. But the third message is really being adaptable and being nimble and looking at how you can adapt and not being rigid. Let's move to the next slide. Okay, so this, Aaron's going to talk about this, but basically it's there's a lot of stimuluses, so that's also a positive note in the last slide. And the last note is really, I think this actually synthesizes a lot of what I've been saying, which Goldman Sachs on the left has the, a 40% hit to GDP in the second quarter, but then a rebound. And the important point here is when you look at the right side, is the rebound for any contagion tends to be very sharp and very quick. So the good news is the darkest hour is yet to come. That's probably in a couple of weeks, if not a month or so, if not 2. But then the rebound will be really quick, okay? So the idea is you really got to hold down in the next 12 months because the economy will come back. So with that, thank you so much for your time and apologies I went a little over.